Ladies and gentlemen, welcome back to Performance Talk. My name is Yul Gordon. I am excited to introduce our guest today. My man Chris is not with us right now. I didn't hear from him this morning. I hope he's doing all right. But we are getting started this morning in this episode with Dr. Shikha Dhaundiyal. Doctor, tell us a little bit about yourself. Forgive me if I mispronounced the name, but tell us a little bit about yourself and how you got into this.
So, first of all, thank you very much for having me here. And thank you very much for pronouncing my name. It was far better than people pronounce it in India. But, anyways, hello everyone. My name is Dr. Shikha Dhaundiyal, and I'm from India, and I belong to a state in Delhi. So I have started my journey of a sports medicine. Obviously, before that, I'll have to make a base. So I have completed my MBBS, and that had got completed in the year of 2016. Now, taking up sports medicine was never in my plan. It just happened with me. And when I joined my post graduation, I was a little skeptical whether to go ahead with it or not, because I had a passion to work in the sports. But yes, it's not easy to make the balance between your post graduation life and also to work in the sports at the same time, because it was really very tiring. And I still remember my residency days where we used to have these planning and training sessions, which were really abrupt, because the training session usually happens either in the early morning or maybe in the late evenings. So we have to complete a residency schedule. And because I was so passionate about working in the sport, so I
Right.
used to travel all the way, maybe sometimes early morning and late evenings. And I attended those training sessions. And eventually, it just happened with me that my first game had started when I had represented there as a field of play doctor, that was with the state level football team. So my journey of a sports medicine doctor had started with a state level football team, and then it just goes on happening. I had worked as a ringside doctor with the boxing. I had worked as a field of play and FOP doctor, or maybe a tournament doctor with the wrestling as well for the 3 consecutive years with the UWW. And I can say that it was a passion, and it was maybe the God had some plans for me, that yes, I had to just keep on moving. And I was blessed to work with almost all the sports in India. So my journey had started with football. I had worked during my post graduation for a while in the boxing, in the wrestling. Then I've joined as a tournament doctor and the team doctor with the Indian hockey team. And then my journey had again started as a team doctor with the senior women national football team.
So,
So
so yeah, you've covered a lot of sports and worked with a lot of different level athletes. If I'm hearing you correctly, what you're telling me and the audience is that you kind of didn't start off to be in sports medicine or work with athletes, but you liked athletics and those kind of things. And as you got involved with athletics, then
yes.
this kind of just happened. Um, not accidentally, but kind of because you loved it, but you didn't plan it necessarily.
Yes,
And then
yes,
realizing what the time constraints are. So
yes,
I heard you talk about working on the field of play. For our audience, that's
yes,
that's that's a game doctor. She's available at the games or at the tournaments. That's the same at the matches for wrestling,
Hmm.
stuff like that. Is Do you work with a staff, an athletic training staff?
The athletic is not that prevalent in India, to be very frank. So
Okay.
I'll tell you a very important thing, as we had been discussing just before the recording as well, that a lot of federations are not very well versed with the medical requirements of the team.
Ah.
So the
Oh.
strength and conditioning, yes, it's important. And but what about the hidden aspect of the sports? I always says the injury aspect. So
Ah.
we always
Yes. Yeah.
we always talk about that this team had won a gold medal. This athlete had won, but what happened to that athlete if that athlete got injured during the field of play, maybe in competition and out of competition? So there are a lot of sports still. I'm not saying in India, preferably maybe outside India as well, where they doesn't feel that yes, maybe a medical team is that much important when it comes to having them on board with the team. So
Okay,
wherever there is a requirement.
so the structure over there is just like, strength and conditioning, usually done by the coaches,
Yes.
and then the athlete. They don't have a you guys don't work with an athletic trainer or a physiotherapist or a nutritionist, or what's your setup over there professionally that where the medical side fits?
Yes, but luckily there is a lot of now involvement of all the support staff in the team because
Okay.
yes, because maybe we can thank the lot of good people who had been in the federation who wants to work for the betterment of the athletes. So now the support staff would involve a doctor, a physio, a strength and conditioning coach, a masseur
Okay.
as well, and the athletic trainer. So I
Okay.
had been blessed that I had worked with them all,
Okay.
wherever which federation I had worked with.
So you so working, let me just ask it as a question instead of making a statement.
Yes.
How do you guys you mentioned that you have all those folks with a team.
Yes.
How are you organized? Or do they work individually as individual entities with the team? Do you work with it as a team within the team? How do they fit together, and how do you fit with them when you're working with the team?
Yes, so that's a very nice question because when we had mentioned the team, we traveled with the team. Supposedly, I had traveled with the football team. So obviously, we all, whoever had been with the team, have to work for the betterment for the athletes and the team because
Right.
eventually we all want the team to win. But at the
Right.
same time, we doesn't want the injury to happen, and that will affect the play. So
Right.
it's very important to maintain the boundaries, mutual respect for each other, for each
Ah.
other's work, and sometimes there could be a possibility that we can overlap each other's branch. But yes, I was blessed enough that I had worked with such a professional people that we always respect each other boundaries. If I'm being a doctor, I'm prescribing that this particular treatment this athlete will require, then the physio was also very much professional enough to follow the norms. And yes, I also mutually respect if the physio has something to add up onto the treatment, because eventually
Okay.
it's all about giving the advanced form of treatment. If I was just being minus somewhere, so yes, the SNC and the physio can add up onto something, and similarly it's vice versa for both the cases.
Right. So that's sometimes we all get in our little bubbles,
Yes.
and we we may not play as well with others as we should.
True. Yes.
However, it's important, and it's good to hear that other countries are, and other professionals in other countries are hammering out these spaces as well,
Yes.
and making sure that you know the team doctor works with the physio, works with the strength conditioning coach, works
Yes.
with the nutritionist, the psychologist, the
True.
everybody,
Yes.
because the athlete is the center point of the whole thing,
Yes.
and without that single athlete or those athletes to make a team, we don't have a usefulness.
Exactly.
So yeah, that's great in the professional life. So all your work has been done in India, correct?
Yes.
And you travel with the national team. You've been outside the country with the national team.
Yes. We had been outside for the Olympic qualifiers round as well.
Okay. So
Yes.
how did you perceive, if you had time? Sometimes you don't have time to view other things, but how did you perceive other countries and how they did, their work with what you do, your sports medicine counterparts in other countries?
Yes. So I had been to the countries, I had met different doctors out there, and I always feel that we have so much to learn from each others. So
Right.
there are times because I'll not say that I'm being the master of all trades. So there
Right.
are some points that I might be lacking, and there are some points that the other people also might be lacking. So if I have to talk about India particularly, like my own country, and we know that we have one of the world's largest population, and I had worked in in a government sector in a hospital, where I had been involved with tons and tons of patients. So when it comes to seeking the injury aspect, when it comes to seeking the clinical aspect, I'm so confident that yes, I have seen all the aspect. I have seen every kind of patients in my department, not
Okay.
to compromise the quality of the care, because our center was one of the leading center in India, which is sports injury center. But
Okay.
apart from that, when I go outside, I can see that patient numbers are less. They are giving more time to the particular person, because they are
Okay.
the level. There are levels to proceed the doctor. In India, it's relatively easy, because there are a lot of health sectors, and you don't need to take the appointments, wait for a longer period of time, so you can directly come to the doctor. And that's how there is a difference in the way we are treating the patients. So there is lot to learn from them, that yes, how they are doing it, how we are doing it. We had an exchange of ideas when it comes to treating the patient. And yes,
Okay.
on field, off field also, when we are, two competing teams are sitting next to each other, and when there is an injury happening, so we are also, we are also taking the idea that how the particular medical professional has been reacting onto that level of injury at that field of play. So yes, there is
Okay.
lot to learn. There is lot to learn, and I always believe that whenever we go to a new place, we are meeting new people. We always have an exchange of ideas, and we always learn from each other.
It's always better when we're operating and acting as one,
Yes,
as opposed to against each other. So
yes,
so I always tell folks, competition is good until it's not.
yes,
You know, it's
exactly.
it's it's great to compete. It's great to have fun in the spirit of positivity, but
Hmm.
but but when you're competing and it becomes negative, that's no good.
Not at all.
I know when I was overseas, and traveling a little bit more, and I'm a strength and conditioning guy, performance guy by profession, but I have, my master's degrees in sports medicine, my doctorates in psychology, so I'm kind of all over the map.
Yes,
But what I found is all my learning kind of tentacles is that when we seek knowledge from each other,
yes,
it's always better. It's
exactly.
always better, and you have to be humble enough, in your own self and in
Yes,
your own abilities to be able to
yes,
give them to someone else.
yes.
Say, yeah, this is what I do. This is how I do it. Maybe you can use it. How do you do it? That's
Exactly.
that's kind of how I try to start conversations when I'm not, in my on my own turf, so to speak.
Yes.
So for me, we have always, to work with a team doctor. Our team doctors only become part of the team at a certain level.
Okay.
So some big secondary schools have, like high schools before university. Some of those have sports doctors that work with them, but not necessarily full time. There as an extra thing or an additional thing that they do. Once you get to the university level and the national team level and professional sports, then of course there's a team doctor all the time. So as the team doctor here, you are in charge of the medical direction pre, during, and post injury.
Yes.
Tell us a little bit about the process that you go through over there, and how maybe it's a little different than over here.
So the first thing is, when we are a part of a team. So the first thing that I would like to have it from all the athletes is to ask their basic medical history. So that will involve an annual medical examination. If they had already got it done in the previous year, so I will always try to compile everything, and would always try to pinpoint that if there is anything which is regressive or negative for a particular athlete or not. Now, I want to put a very important mark here, because I had been dealing with the female athletes, and there are a lot of issues associated with a female athlete. We know that, I think everyone in sports knows about the female athlete triad. but now
Yes.
eventually it has moved on to the RED-S, which is relative energy deficient syndrome. So the most important thing that I have tried to focus on my athlete is to always keep in mind and ask them about their last menstrual period.
Okay.
Because
So we get a
most of
baseline.
them,
So we get a
yes,
baseline,
yes,
and then using the example of the female athlete, you're starting with the last menstrual period because now we're
yes,
looking into we know about the triad, and then the other condition
exactly,
was
yes.
okay.
Yes. So, obviously, to start with a menstrual history, to about their calories intake, and then always associated with all the factors related that their CNS is doing fine, whether they have any gut problem or not. Because I don't want to miss the hidden aspects which can create a lot of struggle for the athlete later on. Yes, we
Okay.
never focus on the psychology and sleep earlier. Now there are a lot of talks that has
Right.
been going on about the sports psychology, but I have myself encountered that there are a lot of athletes who had been a victim of jet lag, had been sleep deprived, having the insomnia going on for weeks, and they are shy to talk about certain issues or stress factors or the anxiety issues that they
Ah.
might already had been having. And
Okay.
that's what I always believe, that empathy you have to carry on with you. You have to make a reputation with the athlete, because no one will come to you and be talkative
Yeah.
about
Yeah.
their issues on the day one.
Yeah. They're not going to volunteer that stuff right off the bat.
Never, never. And
Yeah.
then this is just a basic part. Annual medical examination, and yes, if it is just before the tournament, we have to go through the PCMA or the pre-participation examination. So as per
Okay.
according, so supposedly if I'm going on with the football team, so I have to do the FIFA assessment form, which is a PCMA form. It is a
Right.
thorough head to toe examination. We have to go through the ECG, their 2D echo, their X-rays, their musculoskeletal, and then
Right.
few blood investigations, basic investigations, to know that whether they are not anemic, they are not having any profiling which is just
Right.
having some error on it. And it's very important to look into that, because a slight error in the blood parameters, or maybe their vitamin D deficiency, they're more prone to having the stress injuries, as we all know that
Right.
they are one of also very common in the sports. So if we have any red flag on those areas, if that can be rectified, yes, we can rectify it. Supposedly it's a vitamin D deficiency, we can give them the supplements for a while. But
See
what
this.
about the,
Yes, and I'm sorry. I just a
yes,
quick point here. This is when, for our audience, for our listeners, this is when supplementation is appropriate. If you do all the work prior to get all the baseline information, then you find a deficit. Then you
yes,
go to the doctor and say, "Hey, doc, I think maybe my athlete needs, or the athlete needs," and then this is where we go. Okay, sorry about that.
okay. So yes, this is where the role of supplementation starts. But as we all know that sports is also is very important. Another aspect is the anti-doping. So the supplementation should never cross the line that you are
There we
taking it to
go.
the limits, and for the
Yeah.
purpose of performance enhancement, not for the therapeutic purpose, but everything will be just revolving around in just increasing the performance. Then we call it as taking a substance in the form of doping. So yes,
Right.
one should be well versed with the fact that the supplementation that you are giving doesn't comes under the WADA anti-doping list. So a doctor should be well versed with the WADA rules, the anti-doping rule violations, and the anti-doping list, which actually annually every time it just got having some add-ons and some subtractions going on. So
Yeah,
we should be
updated.
well versed with that. Yes.
Yeah, it gets updated sometimes
Yes.
too often. But
Yes.
I do understand that they're trying to stay in line with fair competition and those kind of things.
Yes.
So yeah, it's important I think it's important for everybody to
True.
to be at least familiar with all the anti-doping agencies and the restricted list and the different levels, simply because a lot of times the strength coaches ask protein what protein powders should I take? Should I
Yes.
take creatine? Should I take yada 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 whatever? And then if the strength coaches are not talking to the doctor, not talking to the nutritionist, and just kind of handing these things out, that's where I see sometimes a lot of athletes get into trouble, especially those athletes who are trying to make it. They're trying to get to the highest levels and they're just a tier below and they want every advantage that they can get. They're not purposely trying to cheat.
Exactly.
They're just trying to get an edge.
Yes.
So yeah, it's important. So moving on, we talked about a little bit about. Let's go back to female athletes. We go back to the female athlete triad and the different situations with females. What are some unique things that you have found that are important to note if you're going to work with female athletes?
So, in the female athletes, like I already had started previously as well with their menstrual history. So, we talk about the menstrual history and menstrual irregularities or abnormality, which is being one of the part of the triad. But what about their last menstrual history? Why I was focusing on their last menstrual history too much? Because if you also know that there is this recent thing which has been happening in the sports, and which we call it as an abortion doping. So now the female
Ah,
athlete, what they had been doing is they are just getting pregnant just before the game, because we know that the hemo concentration would happen, there will increase in the blood count, and eventually it will going to have increase in the endurance. So they just get it aborted just before the games, so that to have the increase in that hemo concentration which can increase the performance. Now most of these athlete doesn't know that why we are asking the last menstrual history. They are thinking that they are just asking it for the sake. Now the second thing is, it's just not about the menstrual history. We should also be focused about the kind of contraceptive measures they had been taking, because we know that there are OCPs, certain OCPs are banned in sports, whether they are going to use the barrier protection method or certain kind of progesterone
okay.
pills or estrogen pills, which could hamper later on comes in their doping. And the third part is obviously itself that menstrual irregularities is one of the component of female athlete triad. So to cater to those 3 points, I always take care of asking the last menstrual history. Now, apart from asking their last menstrual period or whatever history, we also have to just be little thorough and be little deep in asking the way their menstrual cycle works, how much number of pads they had been using, whether they are maintaining the hygiene itself or not, because I myself had seen there are lots and lots of cases of UTI in the females, and they
Ah,
are they are very shy to talk about it. So
right.
they had been cases of increase in frequency, urgency of urine. They had been going on for a long, and eventually there was a paper which was saying a lot of female athletes had been affected by a kidney disease later on in their stages of life, because that chronic UTI had never been treated. They never
Well,
talked about.
see, and that's things that are not talked about. And
Yes,
to be honest, with the number of male coaches in female
yes,
sports, I can, you know, it's 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 an area of training and performance and this whole thing that we don't like to. We like to say, well, you train female athletes the same way you do males. Well,
yes,
you do train them the same, but you
yes,
have to take care of them
true.
appropriately.
Yes, yes,
The care is what's difference is what
yes,
the difference where the differences are.
yes,
So while female athletes, can go in the weight room and do the same thing as males, with difference in the weights, they can do the same exercises. Basically, you have to pay attention to the things that you're talking about, so that there are not health issues or
yes.
inadvertent performance issues down the road.
Exactly. That's very important.
Okay. That's a great piece. I mean, I bet you want to go further on that. I mean, I'm our listeners are probably going.
So the thing is that yes, we can talk on that for hours, because that's such area which had never been talked about quite often. I'll be very honest, because if you'll know about the recent study that is also by the British Journal of Sports Medicine, which had talked about the gender bias in sports as well. So
Okay.
be it the female sports medicine physicians, be it the female athletes, be it the female coaches, yes, there was a lot of uncertainty and there's a lot of bias that had been drawn. I will take a very simple example of a biggest tournament that I had been involved with, and I was shocked to see the situation of the toilets in competition stadium, and there were a
Wow.
lot of female athletes who had been coming out from the game. And when I see the situation, it was very bad. And they had been saying that, yes, whenever we attended the tournament, everything was being taken care of. But apart from putting a lot of stress on the washrooms or the toilets, nobody came
Right.
to clean them up. And that is such area which is very crucial to talk about. Because if they get infected, it's gonna be on them for lifelong. Because if we have to compare a male with the female, so male always are the carriers of the disease and females are always the case of the disease. It simply means that carriers means you are having that component of bacteria or virus inside you, but you are not having symptoms. So
Right.
you can give it to anyone, but a female, if they get involved, it is going to produce the symptoms. And if they'll not talk about these symptoms, it goes on and becomes chronic, and it will going to affect their organs. So this is something which
Yeah.
I think we should put more focus on, and we should not neglect it.
It's this is you know, down the performance continuum. When you talk about these kind of things, you're talking about shortening careers, um, hampering careers, and at the very least, the most important thing to the athlete, affecting their performance. So if I'm having issues because either I won't use the toilets at a competition, or I use them and there's risk, then I'm not going to be at my best mentally to be able to go out there and perform. I have a daughter, and she was an athlete, a pretty good athlete, and she went to play in at the collegiate level. She used to tell me some things way back when. She said, "Dad, it's not the same for men as it is for women." I said, "Well, I know, but you got to go through." She said, "No, that's not what I mean." She said, "What I mean is, come and look at, where we're asked to do this, or where we're designed, or what the area they put us in, or how they take care of us. Come and watch that." So
Mhm.
I started doing that, and I started speaking up, because you can't look at it, you can't see it and say, "Oh, well, that's just how it is."
Yes.
You have to speak up. Wow, that's some pretty interesting stuff. Now we could, like you said, we could talk the next 3 or 4 hours about just
Yes.
that. But
True.
let's move on a little bit to your career, and let's say your perspective of your success. If you're a professional, when you came into the field, like we all do when we start off, we feel kind of, well, what did I get all this education for? I still don't know anything. That's the way I felt. I was like, man, I don't know nothing. But once you get started, what advice do you have for other younger professionals coming in to kind of just take a breath, calm down, and let's move?
Yes. So a lot of juniors had questioning me, and they mailed me, they texted me, because they saw my Instagram profile or maybe some LinkedIn profile. They saw some picture inside the stadium, and they get really fascinated by the fact that, wow, you're standing in the stadium, you're representing your country. And they said, we also want to work with this football team, or we also work with this particular team. So I always had this one thing that when you join any branch, be it sports medicine, be it an SNC, be it a physio or a nutritionist or whatsoever, you should have a passion for it, because life is
Right.
not easy. When you talk about traveling with the team, no, it's not easy. You have to travel for hours to different time zones, get jet lagged, and at the same time, you have to think about yourself. I had been the victim
Right.
of jet lag. I got stuck in the airport for 72 hours. But when I had to
Wow.
take the decision, I had to take the decision. Me and the head coach had to take the decision that whether we should stay back or should send the team forward. We decided to send the team forward because the athlete needs rest more than us. But at the
Right.
same time, we were jet lagged. We have to take care of the team. We have to take care of ourselves. And it's not easy. So you
Right.
cannot just judge a book by its cover because you are just seeing one particular picture which is edited, which has got
Right.
a great caption. and which had got been selected by hundred of pictures, you're not actually looking onto that aspect that we are really working hard.
Right.
We are the warriors which work behind the cameras. We never came in the forefront and we just make a blah blah about that we were working hard for the athletes. Everybody is working hard, have a passion for it, and you should not be like, I want to represent the country. Started from a state level. An athlete also had started from a state level, from a college level, from a district,
Right.
state, national,
Right.
and then goes to international. So love the sports, love your branch, and love doing what you do. Then only you can proceed or get success in your particular field.
Well, that's some great advice. A lot of times, we watch the young professionals come in and they're energetic and they have it all, and they want to be on top, and then they get on top and they don't realize, why do their questions are, why do I have to work these long hours? Why do I have to do this?
Yes.
Well, because that's what we do.
Yes.
That's what we do. If you want to be involved with athletics, your time no
True.
longer belongs to you.
True.
It belongs to the athlete, the team, the organization, and everybody wants some of it.
That's very true.
So, that's great advice. So, the next question is if you had to start again, would you do it again?
So, if it is related to sports medicine as a career,
yes.
So earlier when I had joined, I will be very honest that I had no clue that what I'm gonna do. But today, seeing myself, being very happy, and I just want to say that it's not easy. It's there are a lot of struggles, there are a lot of hardships, but I'm still holding on to that meme of being a sports medicine doctor. I'm loving it, and I'm just so happy to be representing my country as a sports medicine doctor. So I would always want to be one.
So this is a little bit of a question in a question, but so you said you didn't start off thinking that's what you were going to do. What were you going to do?
So being a doctor, being a clinician. Right. On a genuine note, we were always like more towards the studies, not more playing into the sports or all.
Right,
so
right.
I always had this dream that I can be an eye surgeon, or I can join medicine, and I can be in the hospital, see a lot of patients. So that particular time when I was about to get into the branch, I had this notion that I want to be an eye surgeon, and I always wanted to be one. So I was a little sad that no, maybe if I'd be able to do the justice with the branch or not. But then it was all in the destiny, and it was
Right.
all in the fate that now I'm happy that I'm not being surgeon. I'm representing my
tougher.
country. Yes, it's more tougher.
Yeah.
But yes, life in a sports is also not that easy.
No, trust me, I do know that behind the scenes. One of the reasons I started this podcast was to give people a peek behind the curtain, and kind of that's why we don't always ask.
Yes.
We're not always on technical or clinical or those kind of questions. We try to get behind the scene to let the listeners understand and see, hey, look, these people back here, they're working, and they are not the ones becoming millionaires.
Yes.
So while there is an opportunity to make a living in sports, you're not going to be the richest person on the planet.
Yeah, true.
Yeah, another thing is, if we continue to go behind the curtain a little bit, give us a good story of something unique that happened to you while working in sports medicine that you can't get anywhere else, besides working in sports.
So I have this very emotional story to say. I was working with the under 20 women's team. So they were kids, and they were highly energetic, and they played really well. So it was a 1-on-1 with the opposition team, but eventually the goal difference was there, and we lost it to the AFC qualifiers round. And we came back to the dressing room, and the girls were crying like anything. They were like, no, our career had ended, where are we gonna go? And at that particular time, I had realized that no, my duty is not just being doctor treating injuries and just prescribing a rehabilitation or medicines to them. That time I was being there to them like a guide, like a mentor, or maybe like just a helping hand to calm them down. And I've realized that this particular area, which because my character involves a lot of empathy, and I think I was not able to cope up that much because in the hospital we have to maintain the boundaries with the patient.
Right.
Yes, we
Right.
should treat them nicely, but with the athlete, no, we have to draw the boundaries down, and we have to be there with their emotional roller coaster ride, because that would always be in there when we lose a match, and
Right.
eventually we have to go back, make them pick it up for the next game. So I started loving that apart from just treating injuries, there is much more I can do, and yes, then we become like a family. And it's
Okay.
not possible
Okay.
when we are with the hospital, because it had been taught to us in the medicine, then no love and affection with the patient, you will eventually start being emotional. Treat them nicely, be sensitive to them, but don't love them. That what had been taught to us.
Yeah.
But with the athlete, no, they become a part of our family. They are like children to us.
That that is something unique about athletics. There is a relationship there that you
Yes,
form that's deeper than just the everyday consultant, so to speak.
yes, yes,
So if you're a consultant and I come in to work with an athlete, okay, here's your problem. Here's three solutions that you can choose from. Which one do you want to do? Here's how you
yes,
use it. Hey, good luck. I hope it works for you. If it doesn't, come back. We'll try to figure something out. Bye. You
yes.
can't do that with athletes, or that you'll
No,
never see them again.
exactly.
You'll
That's
ne-
very true.
you'll never see them again. And
Yes,
on top of that, I do think that in our profession and working with athletics, because it's the while athletics and the competition is not the be all end all of the world, at
yes,
that point, at that particular time in their lives, it is for them.
exactly. I
And
have seen that.
yeah, and if we don't care about the individual athlete, if we don't care, everything we do, if you're a strength coach, if you're a skills coach, if you're a doctor, if you're going to work in athletics, everything starts with caring.
Yes, very true.
And it has to be genuine, because the athlete will be the first one to tell you, they don't care.
Yes,
They're the
yes,
first ones to tell you. So that's a great point. I didn't really think about that. I haven't really thought about that from that perspective. But yeah, you're walking in there after a tough loss, and basically you're the first one they see,
yes,
or you see them as they come in, and they're talking to you.
yes.
You can't just push them away.
Not at all.
So that's
They
that's
don't
a
even care about the injury that time.
yeah.
If they lost, they don't care about the injury.
Yeah, they could be bleeding.
Yes, they are bleeding, but they are
Yeah.
like, we had lost the game, and then eventually at the same time you have to calm them down, and you have to tell them that this is also important because you have to play the next game.
Right. Yeah, that's so let's go for that's a great segue to the next section. Let's talk about injury a little bit. Let's talk about injury prevention, and then rehabilitation after injury. Doctors often don't get to see athletes prior to the injury. You might see them around, you talk to them, you ask them how they're feeling and those kind of things. But if the young lady, sprains an ACL or strains a hamstring, then you see her in your capacity of solving the problem.
Yes.
So talk to us about the first part of that, which is the prevention and how important that is.
So I'll give you a very basic example.
Okay.
Like we had talked about the pre-competition medical assessment, and
Right.
if I'll talk about injuries, because most of the injuries in the sports are majority of the injuries are musculoskeletal injuries.
Yes.
So Yes, and the contact injuries like ACL injuries and PCL injuries, and there are overuse injuries. So
Right.
when we are doing a MSK examination of the athlete, and if you are thoroughly doing it, so we have to keep in mind few things, whether there is biomechanical abnormalities present there or not.
Yes.
When it is a female athlete, we know they have more propensity to get the ACL injured. Why? Because their knees are narrow. They have got
Yeah.
more amount of tibial torsion. And I have seen a lot of athletes having a flat foot, which is a
Yes.
very important factor to get the stress injuries, to get the shin pains, to get the ACL injuries as well. Then the broader pelvis in the females and this narrow knee may also, aggravate to a lots of injuries. Then talked about the ligaments laxity, which no one talks about.
Right.
And there are lax ligaments, and then we can see a bowler having a shoulder dislocation. He never had it. But he said that I used to feel the subluxation, but now I just tried to have the ball, I just released the ball and I felt my shoulder got dislocated. If that could have been already assessed previous back in the competition assessment, we can change, we can ask with the SSNC coach to just keep in mind that this particular athlete
Yeah.
ligaments are lax, and then the technique can be changed. So that is the reason a thorough assessment just before the competition and the annual medical examination is very important, that we can have always have this thing in mind that this is something abnormal with this athlete and they have the chances of getting the injury.
If some of those things are identified early, then there's things you can do in the strength conditioning realm to
Yes.
help strengthen areas that'll help protect the athlete.
Yes.
I'm a firm believer in prevention. Now I know that every athlete's body alignment and posture is slightly different, but there's some differences that can be pointed out on almost every male and female, just gender based.
Yes.
So when you go into that room and you look around and you thought you were going to be working with all males and you see half the room is females, you have to switch that on in your brain, and you have to understand that, hey, look, we have some Q angles, we have some ligament laxity, we have some other things that might be going on here, and then there's might not be getting the full effort I'm going to get because of where they are in their menstrual cycle. So there's an approach you have to take in the weight
Yes.
room when it's mixed. Now, and I owned a private facility for a long time. I'd have females and males in there at the highest levels of their sport training. And I had one young man ask me, Coach, why do the girls do this? Or why do the girls get to do this and we do this? And you kind of you talk to them different. I said, because they have different things going on. They do the same exercises. The effort's the same. The intensity's the same. It's just, look at them. She is different.
It's
And her,
physiologically both are different.
yeah.
Yes.
And so, but when it's when you get to when they ask those kind of questions, I get excited because that means they're paying attention.
Exactly.
They're paying attention. And, he just wanted to know. And he was a 22-year-old and he went right back over and kept working the way he was supposed to. He just had a question. And
Yes.
I encourage questions all the time. So it's important for those, we call them pre-screenings, but those early identification of things. Every female's Q angle is not the same.
Not at all. Yes.
But just about every female will have ligament laxity somewhere. That's
Yes.
just because.
Yes.
But that doesn't mean it's going to affect them either. It may not affect them at all. But it's nice to know if they do have it.
Yes. Also, one important point I want to bring here is, particularly in females, that when they are going through their ovulatory phase, that is mid part of their menstruation, that particular time there is this hormone which got secreted. We call it as relaxin, and that particular time, most of the ligaments are relaxed, and they have the more probability to get the ACL or the ligament injuries.
Okay. Yeah.
Yes.
So that happens in every female.
Yes. It's with every female.
Okay, and during that time, they're more susceptible.
Yes.
Wow.
So the
Okay,
fourth
so
important point to ask for the last menstrual.
okay. All right.
Yes.
So I'm gonna as we're starting to get into our wrap up time here, I'm gonna ask you to go ahead and skate on into as the competitions pile up, injuries start to happen, whether it's an acute injury or
Hmm.
not, whether it's condition. How do we watch for and prevent those things,
So
or
after
help prevent?
yes, so after every injury, the doctor has to make an injury report, a final injury report that this athlete with this date at that time of the tournament, off the field, on the field, within the training ground, the level of injury, where exactly the injured part was there, you have got it investigated or not, and we have to compile it all together and send it to the federations, because now if the camp is off or they are going for some different leagues, so the federation should be well versed with the fact that this particular athlete is injured or not. Now it is up to me as a team doctor that I have to decide that if some supposedly if the athlete got a fracture, so I'll have to decide that yes, they have to make it plaster for at least 1 to 2 weeks. We have to get the check X-rays done, and if the X-rays comes to be fine after a hairline fracture or so, or maybe a ligament injury, they are fit to return to play. So injuries needs to be tackled very seriously if that is happening in the competition.
Okay, so now let's talk about return to play. Who's there's some very hard line directions on return to play here in the states. I feel like that return to play for everybody is different, but there's some people that talk about, oh, you have to do this for an ACL, or you have to do this for Achilles tendon tear, you have to do this for a hamstring. I think you have to pay attention to the athlete first.
Yes, exactly. So I always believe to follow an optimal loading protocol. It's very
Okay.
simple. There are a lot of protocols with the different names, but the very first stage of the optimal loading talks about the isometrics. And the isometrics also had said that yes, the hold on duration should be 45 seconds and your pain scale should be less than 5 out of 10. So you should never neglect the pain if the athlete is having while performing the exercise. You should
Okay.
not just push the athlete to just go ahead with the exercise. It doesn't matter. You will be fine. No, only proceed to the stage 2, 3, and 4 if the athlete is pain free, the range of motion is complete, there is no effusion and swelling, and you cannot appreciate or see any asymmetry in between both the limbs, whichever
Okay.
part is injured. And then you only can proceed forward with the rehabilitation protocol. So I always follow the same. I always focus on what athlete is giving me the history in every step of the loading protocol. And if I have a chance to put it back, I don't mind, because the protocol should be gradual. It should not be too harsh on the athlete, because we don't want eventually an overuse injury to be overlapped with an acute injury.
Right. The one of the things during that protocol that I've incorporated at week 12. I usually see the athlete about week 12 of rehab.
Hmm.
That's pretty far along, but it's about when they start thinking about, hey, I need to get back on the field.
Yes.
So when I pick them up, it's okay. How are we moving? Did we just load for load's sake, or did we was there good alignment? Where were their hips? What was going on when they took the step? Do they have full range of motion? And can they do all these things pain free, and then start to do at a lower level,
Yes.
change direction?
Yes.
Can you change direction walking? Can you change direction, or can you move backwards? Can you jump and land? Can just simple things that
Yes.
athletes do without even thinking about?
Exactly. Yes.
So, with that said, understanding all of that, I hate to cut this off now, but we are at the end of our time, and I feel like we were just getting rolling, and we were just
Yes.
getting started. But it's been great having you on. I appreciate your time. Appreciate you working with me at the front part of this to get everything together. Ladies and gentlemen, we are with Dr. Shikha Dhaundiyal.
Thank you.
Has been our guest today, and it's been a great time, and I appreciate having you on.
And thanks for having me on board. And it was a really an insightful discussion. We also had learned a lot from each other. Very insightful discussion, and hope to have more of this kind of discussion. Hope I can just add on some of my expertise and experience, so that can help a lot of people,
Well,
and that can just clear the clarity.
you have just been put on the back burner and not taken off. So we will see you again.
Surely, definitely.
You will hear from us for sure.
Thanks a lot for having me here.
Ladies and gentlemen, this has been Performance Talk. We'll see you.